Hi guys, this is Sam Cabot. I'm a physical therapist with Cabot & Associates Physical Therapy, and my wife Jody, also a physical therapist with Cabot & Associates, and we're here today to talk about video number 3, which is appreciating the diaphragm and the breathing into the diaphragm and how that also communicates with and works directly with our pelvic floor. And so we're going to talk just for a moment about where the diaphragm is and where the pelvic floor is. The diaphragm, again, is the area right in the midsection of the body. It's a muscle that goes all the way around the body, 360 degrees, and I've compared it in the past to an inverted umbrella. As you breathe in, it kind of opens up down into the abdomen, and as you breathe out, it comes back up again. There's this wonderful motion that occurs for so many valuable reasons. Breathing is one of them, but as well, it helps move the gut and the organs, which need movement just to do their job as well. And if the diaphragm moves down into the abdomen region and moves the gut in a beautiful way, the bottom side of that is our pelvic floor. Our pelvic floor is the area, the musculature that we sit on when we're sitting on a table. It's also the area, the musculature that's around our plumbing. And so if you think about that area that we sit on that's around our plumbing, that is also like a diaphragm. So our upper diaphragm and lower diaphragm. Another analogy I share with my patients sometimes is, imagine, if you will, a two-masted ship. A ship with two masts and two sails. And as the wind catches the sails, both the sails go in the same direction. The diaphragm and the pelvic floor will both go, ideally, in an efficient body in the same direction. So as Jody breathes in, diaphragm comes down, tummy goes down and pushes into the pelvic floor. Both sails go this way. As you're practicing this at home, lay on your back, breathe in, feel your diaphragm and your pelvic floor come down. As you breathe out, feel your diaphragm and your pelvic floor come up. Start to become more aware of this. Again, don't force it. Don't push the diaphragm down. Don't push the pelvic floor out. Allow the two to move with your breath. Some people call it riding the breath. Let the breath come in and bring both down, and then again, both up. Now, some people may have a challenge where one side of their diaphragm or the other side doesn't move as well, or one side of the pelvic floor or the other side doesn't move as well. We treat both very often in the clinic, and there's lots of reasons why it may not move as well. But it's a great technique to practice at home to try to synchronize your diaphragm with your pelvic floor, to try to move them up and then back down as you breathe. This doesn't just have to be in a supine or on your back position, but it's a great start. And once you get better at this, consider going into a sitting position, or a standing position, or a position that you work at that's unique to your lifestyle, to see if you can also connect your diaphragm to your pelvic floor. Thank you.